Hello and welcome back. Once again, I am Ashok Rajguru, your tutor. And in this video, we shall be looking at the prognosis of multiple sclerosis and what is the kind of support we can give to our patients. The objective of this video are to understand the likely prognosis of a multiple sclerosis case from the homeopathic perspective. Now, many people want to know their prognosis. In other words, how is their disease going to proceed? What does the future have in store for them? They find it easier to cope when they know more about their disease. For instance, they may ask for survival statistics, or they may search for that information on their own. But again, statistics can be confusing, they can be frightening, and moreover, they are very impersonal. For instance, if there is a person who is told that his chances of recovery or survival are 98% or 99%, which means that 99 cases out of 100 are going to go on a very good path of recovery. But that's not very comforting because as far as that person is concerned, that one single person, it's 100% failure. So people are very wary and they are quite scared about the prognosis. Fortunately, in homeopathy, we don't have to just depend upon statistics. We have some other guidelines that can help us to inform our patients better. Before I begin this presentation, I would like to express my gratitude to Dr. André Sen. He's a French homeopath, author, and he's also running his school of homeopathy known as the Canadian Academy of Homeopathy. He's written many articles which are available free on the internet and which have tremendous educational value. So please do visit his site, and a lot of content of this particular video are drawn from and inspired by his work, which is available on the internet. We had seen in a previous video that apart from genetic and environmental factors, stress was a major factor which can trigger multiple sclerosis in a person who has the susceptibility and who has been exposed to the environment. To give you some numbers and statistics here, in 10% of the cases reporting multiple sclerosis, the first appearance of the symptom occurs after physical injury. So physical trauma has a big role to play when it comes to the trigger. 50% of the people will experience a relapse after physical trauma, especially concussion to the brain or spinal cord. So that's a very high number. 20 to 50% of the patients will develop fewer viral infections compared to the general population. Now that is a very interesting fact from the homeopathic point of view, because this is the case of a stronger disease warding off a weaker disease. So this is something which Hahnemann has mentioned in the Organon and is one of the pillars of homeopathy. Another fact to note is that they have people who are suffering from multiple sclerosis have 4 times more susceptibility of exacerbating an attack of sinusitis. So they get more sinusitis, at which time their rate of exacerbation is doubled. So as we'll see later in this video, the case management requires constant attention of the practitioner, who will take care of any such exacerbations which occur along the path to cure. Now let's take a look at the natural course of multiple sclerosis. As we mentioned earlier, the course of this disease is completely unpredictable, but it can have 2 paths. One is an exacerbating remitting. That means there are periods when It's exacerbated and at times when the patient is free of symptoms. There can be a sudden deterioration following a remission. But a complete or a near complete alleviation is possible in such cases. However, if the course of disease in the particular patient is progressive, then there is no remission. It only gets worse and the person's health keeps on going downhill. When it comes to talking about prognosis with homeopathic treatment, then these are a few facts which we should keep in mind. Remember, multiple sclerosis is an inflammatory process and therefore is quite amenable to homeopathic treatment. The extent of recovery naturally depends upon the state of vitality of the patient. If the patient is very sick, too old, with a very poor vital force, then naturally the prognosis is poor. Another important fact to remember is the clearer the homeopathic case, the better the prognosis. What exactly do we mean by that? To have a clear homeopathic case is that the case is presenting with complete symptoms which include locality, modality, sensations and concomitants, which we shall see later are areas we can look for. The prognosis is extremely good if the totality of the disease symptoms and those presented by the remedy are very close to each other, which are seen in the same one and the same remedy. If it is a simile, that means it comes close, or as one of my teachers, Will Taylor says, it's not a similimum, it's a closicum or a closimum. In that case, of course, the prognosis is not very good because it will be a long, protracted case which will require a lot of follow-ups and changes or remedies that follow well. Naturally, if there is extensive change in the organism, in other words, there is organic or pathological damage, then again the prognosis is poor. The good news is that there are many reasons for a good prognosis. If the patient is having a wide variety of mental symptoms which are expressed in strong psychosomatic expressions, or the patient is very emotional, and the exacerbation of the disease takes place due to these mental symptoms, then we are able to find the remedy more easily, and naturally the course of disease will be having a much better prognosis. If the symptomatology is fluctuating due to weather, climate, heat, cold, allergens, menstruation, hormonal influences, in other words, modalities, if there are very clear modalities presented in the case, once again, the prognosis is very good. Strong associated syndromes such as hypoglycemia, PMS, problems of circulation, sleep patterns, appetite, moods, energy fluctuations. Once again, these are concomitants and good strong concomitants with strong modalities which will help us to isolate and select one good remedy. One interesting fact noted by Dr. Andre Sen is that patients presenting with eye symptoms or problems of vision also provide a very good clue to the remedy. Further, good prognosis is predicted if the course is benign, there is not too much damage, the course is remitting, exacerbating instead of the other one which is only going downhill. If the response to the first prescription is good, which means that we are already on track and all we need to do is maybe find supportive remedies and take appropriate action to control acute flare-ups such as respiratory problems, flu, etc. And the patient, of course, has more vitality. That makes a big difference. Vitality, again, is a function of lifestyle. If the patient is having a good lifestyle, a good diet, and a good exercise regimen, then naturally the patient will be able to recover faster and the prognosis is very good. So this is a point which is related to the one above. Patient has a better lifestyle, or even if the patient is not having a good lifestyle, there is an intense desire and a cooperation from the patient to change that lifestyle for the better. Lastly, compliance to a treatment plan, because the homeopathic practitioner and the patient, they are actually working together. It's not like allopathy where the body is treated like a machine, and once you have put your car or your machine in a garage or a workshop, it's for the mechanics to fix it. That's not the way it is in homeopathy. We are working in tandem with close cooperation with each other. So the practitioner and the patient, and of course all supporting members of the staff as well as family, are very important components which can make the prognosis good. Another point which is mentioned by Dr. Andre is that if the treatment is started in dry, warm weather, it will improve the chances of recovery. Whereas cold, wet weather or rapid changes from warm to cold will cause exacerbations and make the cure difficult. Sometimes the person may have to move to a place where the climate is drier and warmer. If people are living or are residing in areas which are having cold, wet weather, or they're having wide fluctuations in temperature and weather conditions. Another important thing is the homeopath should be available very close to the patient. So you don't take up cases if people are living far away, or don't take cases over Skype and follow-ups on the telephone. You should be staying close by because you may be required to respond to the acute crises as they evolve. And importantly, don't look for any specific remedies that have been used by other practitioners. Right in the beginning, when we were talking about etiology, we mentioned that multiple sclerosis is a highly individualized disorder. And it is these individualizing factors which will guide us to the remedy and not any specific used by other. Case studies are important for the simple reason they show us the path. How did the practitioner arrive at that? And that is the purpose of this lesson. We will be seeing how Dr. Patil was able to come to the remedy and can we replicate that method. Now, there are some symptoms which need to be looked at carefully and taken into your analysis. Naturally, the first guideline is the common symptoms are of little value to us. We are looking for those symptoms which are individualizing the patient. So, sides are very important, whether it's a left-sided pain or it's a right-sided pain, or is it alternating between the sides, or is it going crosswise, for instance, from the left upper to the lower right. These are things you will have to explore by asking the patient questions during case taking if they have not been mentioned by the patient himself or herself. Aggravation by hunger is also another important. That means appetite is a very important rubric which must be used and which must be asked if it has not been mentioned. In case of women, aggravations before, during or after menses are equally important. As mentioned earlier, eye symptoms, and what Dr. Andre means by eye symptoms are if they are reporting any black floaters in the eye or any distortions of vision, they are important, even though eye symptoms are quite common with multiple sclerosis patients. Time modalities, as with any other case, for instance, is it aggravated, ameliorated at a particular hour or between a certain time frame, or at twilight or during daybreak or something like that. That's also very important. Naturally, modalities due to weather are also very important, and as mentioned earlier, windy cold weather, or whether it is dry, or whether it is stormy weather that aggravates or ameliorates, should be taken into account for analysis. One interesting feature mentioned is the effect of clothing. All of us know the remedy lachesis and its relationship to tight clothing around the neck particularly. So clothing has got a very great relevance if it is making an effect on the symptomatology of the patient. So please take that into consideration and observe if there is any such thing. Naturally, like any other disease, a good diet is often the key to vitality. And good vitality points to a good prognosis. The diet should be low on animal protein. So meats of any kind, whether it is poultry or whether it is farm animals, they should be low in the diet or altogether absent. And the diet should be high and rich in vegetables, fruit, nuts, and seeds. You can also advise your patients to avoid processed food, white sugars, and processed flours. It should be also advised that they should cut down or restrict their intake of tea, coffee, fizzy drinks, avoid alcohol altogether, and also avoid tobacco altogether. As far as oils are concerned, whether they are taken in salads or used for cooking, in particular olive oil and sunflower oil is very good. You can also consider advising your patients to have supplements of vitamin D, which has been found to be very useful, and those supplements which contain calcium and magnesium. Now it comes to what is the other support that you can provide to your patients. Right in the beginning, we said that one of the most important triggers and one that can be controlled or that can be worked on is reduction of stress. Today, meditation, yoga, tai chi are techniques, or you can say they are interventions which are proven to be very effective. There is a lot of literature. There are many research papers available both on the internet and in books available in bookshops, which emphasize that meditation, yoga, tai chi are practices which can help in reducing the stress levels, and that can be a key to a good prognosis. Also, music, painting, dancing, any such kind of pursuit for artistic expression has also been found to be very curative. As mentioned earlier, as a homeopath, you should be available close by and ready to respond to manage any acute exacerbations such as acute colds, flus, etc. So your presence close to the patient is very, very necessary, because then you are able to observe and note down symptoms which may not be expressed in words over the telephone or even on Skype. And like with all other cases, exercise and rest should be advised. Lifestyle advice should include observing a good sleeping regimen, giving adequate relaxation in order to promote and accelerate the cure. So here is a summary of the points that we discussed in this video. We talked about the factors that affect prognosis. Then we looked at the important symptoms, which essentially are what our classical masters have taught us. For instance, if you just follow Bonninghausen's advice of having a complete symptom by eliciting the location, modality, sensation, and concomitants, and of course, these factors of the concomitants as well. And lastly, we talked about what is the kind of support you can give by providing advice or referrals where they can learn meditation or yoga or tai chi in order to elicit a stress avoiding and a relaxation promoting environment in their lifestyles. So diet, lifestyle, exercise, all these things count tremendously in producing good results. So thank you very much for your attention, and I hope you will be able to use this information when you're dealing with real cases of multiple sclerosis. So thanks a lot and see you again soon, and please do participate on the forums. Bye bye.